Welcome to the Ascent podcast, where we spotlight leaders shaping the future of healthcare and explore how innovation and AI are transforming medical practices. I'm your host, Geet Kera, founder of AIS and Partners. We help healthcare businesses harness AI to unlock growth, operational efficiency, and better patient outcomes. Today, we are joined by Nestor, a respected voice in the healthcare field who has spent years navigating the evolving challenges of running and scaling a medical practice. We will be diving into the six biggest challenges facing medical practices, from staffing and retention to cost pressures and balancing patient experiences with profitability. So, Nestor, thank you for joining us. To start with, could you tell us a bit about your background and what drew you into this space?
Sure. Thank you for having me. So, as you mentioned, Nestor Rodriguez, I'm a board certified emergency medicine physician. And currently, I kind of function two roles. One, I'm a medical director for an emergency department at a local mid sized hospital, also a medical director for the local EMS services, but also then co own with my wife, Ashley, a wellness facility that's cash for pay that looks at medicine a little bit different. So for me, kind of interesting background. Was born in El Salvador, first generation immigrant, first one in my family to go to high school, college. Grew up with single mom in a Spanish speaking home. Went through ESL, got a scholarship for a great high school, Loyola High School in LA, subsequently to Yale University, and then did medical school at the University of Wisconsin, where I decided to stay and practice emergency medicine because I wanted to be a space. One, I wanted to be a doctor where, in the plane, if someone needs a doctor, I don't shy away or get scared. I actually am like, here I am. And then two, be able to provide healthcare in a unique environment where trust is immediate. Have to know about a little bit about everything, and also then have the opportunity to use those skills for everyone else. So I was a chief resident for my emergency medicine residency class, and then stayed on as assistant program director for several years. So have seen academic medicine, private medicine, and then obviously the pay for cash kind of setting in terms of healthcare and everything from downstream effects of ignoring your health, not caring about it, or the broken system to people that, look at their health as a longevity tool.
Thanks to you for joining us. And I think you see a remarkable journey, like from the background that you come from and you've reached places. So you've seen both the patients and providers, right? What's one shift you have seen in how practice is run today compared to 5 years ago?
Yeah, so I think regardless of the system that's there, I think the pressures of time, the pressures of who are making these decisions, right? You kind of hear it on the news and just in the rumblings in the hallways of providers. Back in the day, it would be more physician ran business models, practices, versus now it's more metrics, and having to hit these metrics. And also then a lot of private equity funds or companies coming in, which it's more ran like a business rather than before, I would say more practice based. So those have been the biggest changes that I've seen. And that with that comes a different shift in how we work, how we're evaluated, and what pressures we have, which I don't think the medical education system has caught up with, right? So that's why you hear doctors get frustrated at times of how do I navigate this environment? And now you throw AI into it. Another element that, again, they're starting to teach in medical school. But for example, providers that graduated when that wasn't in town, we have to navigate it ourselves.
So you mean to say the practical knowledge or the practical experience that you get while working is way different from what you're being taught in the medical school? That's a gap which is increasing with time now because
Correct.
of the new elements being added every time.
Correct. Yeah, the practice of medicine still stays the same, right? Which is good because we're there's a board certification for a reason, right? The processes we go through, they're long, but they're worth it, and they're to keep patient safety. Just the business side, the evaluation side, the time constraints, those are the things that are new, and we're navigating differently. That
Now, as compared to what it was 5 years. So you mentioned your wife, she owns a wellness practice as well, right?
she is, yes.
And how do you find it different? Like you working in a different environment than she's owning a practice there. I mean, it'll be like totally different, right?
It is. The biggest change is that in our wellness facility, people want to come to see us, right? And they have a preventative approach to life, or they have an interest of changing their mindset of what health should be. What I commonly explain to clients or to colleagues is, if everyone in the world, I would argue, thought of their health the same way they think about their finances or their profession, we'd be different. But unfortunately, health is kind of one of those. If I have enough money in my bank account, then my health, sure, it's there, but I'm not going to optimize it. Versus, we always want to optimize finances. We always want to optimize our careers, or our relationships, right? But health kind of lags for whatever reason. And so versus in the emergency department, a hospital setting, right? People are coming for chronic diseases, freak accidents, or when the healthcare system has kind of failed them in some way, or they themselves have kind of ignored the symptoms and now they're in a bad spot. And so it's two different worlds that we practice in, both for good and bad. And it's been quite an experience to see both.
I can imagine that. So in terms of like staffing shortage and retention, this is something we kind of hear everywhere. Finding and keeping good staff has become harder than ever. From your perspective, what's driving this and what can practice do to create a culture people actually want to stay in?
Yeah, so I think that's a great question. That's something that, and in my leadership roles, we go round and round and round. I think it's multifactorial, so not as easy. And so one is it's because of the landscape of what healthcare is. People that have been in it for years that see the difference, see the increased constraints, the increased pressures, are deciding to go elsewhere. Right there's less stressful things that you can use your skill set. So you have that workforce that's leaving. At the same time, the people that are coming in are coming into a world where everyone's after the same person, and then it becomes almost like an economical thing, right? Like, well, okay, who can recruit, who can pay more, who can provide that package? Because in is particular in smaller areas, right? It's the volume pool is the volume pool, right? Versus in bigger areas, you have more schools, you have more students you can generate from. But then it becomes, okay, how do you compete to keep the staff from coming? It's a financial thing. And then you have kind of the elephant in the room where it's, well, who are making those financial decisions? It used to be more physician led. Now it's more MBA, more like a business led facility. So if you take the strategies or the conversations we have in boardroom and any other business, they make sense. It just feels a little bit different when you're talking about healthcare, just because we've never thought that way, right? And so when you combine both of that, that leads to burnout where people are like, oh my God, they're demanding so much more of me now. And now, because of finances, they're taking benefits away, or they might be taking hourly pay or bonuses. You know, After a while, to be honest, that altruistic part of why we do our business, it kind of goes away just because of the burden of everything else you're feeling. And so I think that's kind of what's led to where we're at now. And COVID made it even more of an
Mhm.
impact, right? So now the other aspect that exists from a financial is hospitals are using, staffing, not so much in a provider, but in a nursing space from other countries. And again, they could, depending on how they've leveraged that partnership, it's either cost friendly or cost them more. But those are solutions people are taking.
Hmm. Have you seen like any system or tools that make onboarding or daily workflow smoother for staff, or you think it's more mainly just the culture shift that's happening right now, which is affecting them?
No, so I think it was funny. I hadn't thought about this to a recent conference of Dr. Pearl. He's out of Stanford. He's a big AI proponent. And he mentioned that in the hospitals, we're still the only business, I would argue only, maybe there's a couple other I'm missing, that we still use fax machines to communicate, right? If you look at our children now and our students now, like you tell them a fax machine, they're like, what are you talking about? Partly is just the old school ways we have, and then it's how much work do you have to do to update these systems when you're already in a low workforce. So for onboarding, for example, when it's done well, it's been some of these private institutions that have put money into how do you onboard people? How do you turn this into technology? How do you make it accessible? Versus the people that don't. And it's still old school. Hey, you come in for 8 hours of listening to someone speak on pretty dry topics. You have to make it more creative, have to make it easier, more accessible to people. And as it relates to AI, right, that we mentioned, I think that's where a simple way where AI can help is just how do we use it? How do we incorporate it?
Hmm. So you think that there could be make some of the things easier for staff because they're still going in the old way. So if those things could be made smoother for them, then maybe they can have a better time for the actual things that they are supposed to do.
Correct, correct. Yeah, for example, yeah, so from an onboarding or hiring staff, right? Educational programs, things like that, where I think hospitals or facilities, we do it in our wellness practice. I can create curriculums now to teach my staff what I want in minutes with AI.
Mm.
Obviously, then the time it does most of the work, and then I have to go in, double check it, add the way I want to teach it, and things like that. Which before, when I was in academics, right, it would take us months to years to create a curriculum. So that can be changed. What EMR systems are doing, and we have Epic in our backyard, which is a great system, and they're kind of leading AI too.
Mm.
They're working on how do we incorporate AI into the actual documentation process, which is another metric of how much we have to document has changed, right? Back in the day when I was in residency, we had a T sheet, which is literally one sheet of paper and you're just check marks, like your pain and where you are. If you pick it up now, we would have no idea what we're trying to tell each other versus to now the extensive amount of information we have to write as part of our charting. And then it's, the how do you implement all those things so that the provider knows how to use it, right? And
Mm.
anytime you talk about technology, you also have to remember the ways of docs, right? You have the older doctors that their phone is a difficult thing to use versus the new
Mm.
ones that like could do everything in 2 seconds. How do you bridge that? And I think AI does a good job of like, if you pose it the right questions, it can help you troubleshoot some of those.
Mm.
It's
Yes.
just, are we asking the right questions?
Correct, correct. Asking the right questions and trying to solve the problems that it should solve really, and keeping the human angle outside the equation for AI to do. So you mentioned that every practice feels the pinch of rising costs, which are having, and from insurance in, reimbursement to payroll and supplies. How can a clinic stay profitable without compromising patient care?
Yeah, so I think that's where then it's negotiating contracts, it's offering, from a workforce, for example, is it costs a lot to train someone, right? So the debate's always, even at the hospital, even at the wellness facility we own, is how much is it going to cost me to train? And then the risk is once I train them, then they go somewhere else because they get paid more. And so it's how can we upfront anticipate that and create an environment where we not only train them, but we intensivize them
Retain them.
to keep them there, right? Otherwise, you've spent all this money and then they're gone.
Yeah.
And which
Correct.
adds to, so that's one way, right? I think the other way then it's how do you negotiate on the back end, at least from a wellness facility with the suppliers, with the manufacturers? How can you leverage, for example, in the wellness space, it's can I speak for you guys? Can I become an educational center for you, right? To negotiate some of these costs of equipment and services that they, or if I'm going to purchase this, can you help me then market our practice? Things like that, which again, we don't, I would tell you if I didn't own a wellness facility or a private practice, one, maybe it's changed now. I'll say that before I say this is I don't think we're taught that. And then in the hospital, your average doctor isn't in those C-suite rooms talking and making those decisions. And so just learning that skill on how to do that and how to ask more. If you compare that to, you had a business person on here, that's a no-brainer, right? They get taught that, they do that, and they don't have a problem with that. We in healthcare, we just not taught that.
So do you think automation or AI can help here? Like, for example, admin work, scheduling, billing, or anything like that can be helped with the AI to reduce some of the load
Oh, for
on
sure.
staff?
Yeah, because I think with AI, what it can do is it could capture all the information and highlight, um, in a quick format. For me in the emergency department, quickly what things I do that I haven't built for, or things that I haven't thought about that I'm actually doing every day in day out, right? Because right now my biggest, if you look at how we get paid or how charges or things are made, right? It's how much you document and how do you document it well, which has led to some frustrations, right? You think you have all the information there. There's a coder in the back who's trained to say, I pick all this information, depending on what system you have to track that, that could be perfectly aligned or hit or miss. And I
Mhm.
think AI can help us in that regard as providers. So it's not hindrance to say, "Oh my god, I gotta do more," to, "No, it's just picking up with what I already did and what I could charge." And again, it's a different perspective of there's people that have been dealing with that in private practice already, but most healthcare systems and things like that, we don't think that way just because it's a higher level conversation.
Mhm. So, in your practice and the wellness center that you own, your wife already owns, like, do you have these kind of AI things already going on, or that's something you see to have in future?
Yeah, so a little bit of both, right? So and then I always tell people, one, don't get scared of AI, right? AI can serve and do a lot of things, and you're constantly told all the things that it can do, so it can become overwhelming in itself. And so the approach we took is like, okay, let's dabble on a little bit, like pilot programs of what AI can look like, and then build that knowledge. So then when we engage with companies that can do that, we know what we're talking about, or at least understand what they can provide.
Mhm.
Otherwise, it can get overwhelming, right? So things they always ask me, where have we used it? One is to develop curriculums, like we mentioned before.
Mhm.
What would take me 6 months to a year, I can knock out in a day,
Mhm.
and create curriculum. So that's a simple way of doing it. And pretty soon, as when you work with it enough, it starts learning how you think, what you want, right? And how you want to deliver that message. And
Mhm.
so you can customize it to you, to your staff, or to your environment. Two, the second way we've used it is marketing, in a sense of you can use it as like, okay, who are the biggest players out there? Who are the biggest names? I've tried it where it's like, can you tell me what this person in this tone would say based on everything you know? And it'll tell you how to market something, right? Versus, okay, I see that. How do I do it? Right. And to me, it's always like, how do you ask the questions? What do you want to say? And are you comfortable with that message and can you vet it? Right. That's the human component that's always going to need to exist. Spaces where we are dabbling our feet in is the automation part, right? And I think that's the biggest, where if you ask a guru or company that's in it, that's the buzzword that they'll tell us, right? Automation, automation, automation. But what does that mean, right? Is it automation to get on a patient to come to your clinic? Or is it automation on the back end? Is it automation on the financial end? Like what is it? And I think there's challenges to all of them. So it's just
Mhm.
looking as a company or as a hospital, where is that challenge and how can we do it? But then
Mhm.
investing in that team, right? I don't know how many facilities have, I do have a friend that works at a local hospital that I think they're ahead of their time because they're a small hospital, but they have an informatics group, right? His job is to incorporate AI. And, when he had that discussion with his CEO, the conversation was like, we're too small. Why do we spend all this money? But now, 5 years into it, they love that they have, because of they're probably doing cooler stuff at some of the bigger hospitals that still haven't incorporated some of this stuff.
Correct, correct. So, right, I think as you mentioned, where I think most leaders or the senior people are kind of struggling to understand where it can help, how it can help, and what benefit you can achieve. When, as you mentioned, it can really help in all the areas that you specified there. It can help there to, yeah, automate the workflow, what you do on a day-to-day basis, rather than someone doing it. If you can have the AI do it and you review it. Second part of it is that it help you to generate the lead and to have the sales and marketing piece going on, so that you can have more people approachable and coming to you, and more people aware of your practice. And again, third is that in terms of the revenue, it can help you analyze some of the data points that are already there somewhere but not being read through and presented in a manner that can help you to decide, oh, this part or this practice or this product is making more benefit to us, so maybe we need to kind of invest more. So that kind of analytical based decision it can kind of help you to make. So it can help in operations, it can help in the client engagement, it can help in terms of the customer engagement, also in terms of doing some sort of scheduling there, getting the feedback and then sending those messages. So different areas depending upon what is the challenge that you have right now, which you think is the most critical one to solve, and then you can kind of go on from there, that first we want to solve this, then second is this, and this is the third priority for us.
Correct, correct. And I think to your point is the C-suite, and I've been part of it. It is that of like, how can it help, right?
Mhm.
So I think doing pilot programs, asking those
Mhm.
questions, and if we engage a company, this is where I think the companies that do that would benefit, in my opinion, would be if they're willing to come on as like, well, let me show you what the
Correct.
project is. Because if I don't understand it, then that company trying to sell me a service I don't understand, it's not going to go
Mhm.
anywhere, right? Especially when in the world of I'm already trying to manage these budgets, I'm not gonna I'm not gonna see it as innovation. I'm gonna see it as an expense.
Correct.
Right, but if we see it as innovation to improve that expense
Mhm.
and that profit margin, that's a different story. It's just not pitched that way, or I think there's that disconnect of when you sit at the
Mhm.
table, is everyone at the table understanding it? And again, with AI, a small pilot program could quickly get everyone on the same page at
Correct.
a given table.
Yeah, yeah. The best way to adopt it in a profitable or in a seamless or in a positive manner is to do sort of a pilot program, see the benefit coming from there and see, what it is achieving there, and get that benefit, and then see, okay, then next you move on to the next, and then you move. That way the team can also align to it and they can adopt in a better manner, and then you can also see the actual benefit coming on it, and then you can see it really as an investment to you rather than looking at an expense to you right now. Because
Correct.
yes, things take time to kind of get that actual benefit, as you mentioned, that the small practice that your friend was working on, that it took a while for them to realize that okay, they have done better than others because they've invested in it in the right time.
Correct. Correct. And I think that's the disconnect that exists right now. Is just I don't know, and that's something I don't wanna think about, and it's like, I don't even know what it's gonna do and
Yeah,
help. As soon as
correct.
you start using it, right, that's where these small things to the point where for me, I'm a big proponent of it. I ask everything through it, right? And so people will tell me, "Hey, am I getting less intelligent?" I say, "No, because it's the way I'm asking it. It's just I'm getting more efficient."
If you sell it like way that gives you your time back, or if you really can see that benefit coming out of it, then I think that that's the right approach, to take it forward. So in terms of the patient also, like, do you believe like personalized follow-up or AI assisted communication can help retain patient or improve their loyalty or improve that kind of a satisfaction there?
Yes, I think for that, it's an interesting one in terms of, there's a fine line, but I think where it could improve it is addressing basic questions, right? Addressing knowledge gaps, things where now the time you do have with a patient is more meaningful because any things that they might have questions that you just have to educate them up to have that educated, like it's already done, right? And can if you can create a system where that's already there, they could see it on their own time, on their own ways, then that, for example, 15-minute doctor appointment doesn't feel rushed, right? Because you've looked at it, you guys are both coming on the same page. Now you could have a better discussion of that. And again, it's just how you control what information you give, right? So for me in the emergency department, something I know people are doing, but one of our biggest issues at times is everyone comes to the emergency department. Why? And more so after COVID, in my opinion, is because they realize how convenient it is. Right? It's the fastest, it's the quickest to get. And even though we knew that, before COVID, COVID made it a system because everyone had to go there versus an urgent care versus primary care. And so, can you use AI in a way to help triage patients, right? But still keep people safe? But more so than educate them so then they know what to expect when they come in. To me, that'd be huge because a lot of times where the issues arise is misunderstanding how long these things take, what the process is, why we're doing these things, and we're either good at it or we're not. In the
Mm.
hospital system, right? As a doctor, we're given these metrics to follow, but in the real day to day, minute to minute grind, some are better than others, and it has to do with circumstances, right? It's not as easy as just train. So I think that's where AI, if you can create those type of automations or pathways, can be a win-win for all, and overall, keep us in the game longer because that stress level's down.
Yeah, yeah, I get that. And so with so many clinics and medical practices opening, visibility is a key. How practices stand out both like locally and online without overspending?
Yeah, so I think that's where AI, right? Like if you look at it, it can what you had to trust an agency to do back in the day, now AI can compare it, right? Your SWOT analysis, your what you used to, they would call it secret shopping and call your competitors, see what they're doing. AI takes that all away, right? You could say, hey, in my local area, what is everyone doing? What are they doing well and bad? And you can leverage that to create your own marketing or awareness techniques. And again, once you have that information, it's how you want to do it, right? Because everyone's going to be promoting for a different person. Everyone have as a different twist to it. So it's just using all this information that would cost you a lot more money previously to get. And then two, it brings you to understanding, again, similar to what we talked about with the CEO and AI, from an owner to like a marketing agency. Okay, I see eye to eye of what you're talking about versus before it's like, I don't know what you're talking about, right? Like then
Mhm.
it's an expense rather than an innovation thought
Mm.
thought frame.
And if you had to pick like one area where leaders should invest as per you in the next, 6 months or so, like what would that be? Would that be system improvement, staff retention, strategy? What would that be as for you?
I think operational efficiency, and that's where AI can help a lot because if you systemize that or you make that more efficient, then the annoying part that everyone says, "I wish someone could change," or the annoying part where, like, we feel that there should be more of a control over goes away, right?
Mhm.
The in the emergency department, we know that everything is gonna come to us, not when we want it, it's when it comes to us. So that's never gonna change, and that's partly why we go into emergency medicine, right? Because we like the organized chaos. What we
Hmm.
don't like is the inefficiency of the system to run what we want to do, right? And everyone complains about it and everyone says, I wish someone could do it, something about it. Now I think with AI, we could solve a lot of those issues. So when you solve that, then it goes back to what, old providers would say back in the day, I love it. It's awesome, right? Like it's we're getting burnt out by things that are more operational than the actual practice of medicine. And I think that's where AI can fit in and help us out.
That's an incredible insight, Nestor. As we wrap up, if you were advising a practice owner listening today who is overwhelmed by all these challenges, what's one step they could take tomorrow as for you?
Yeah, so then to start dabbling with AI, right? Just start asking some of these questions just to get to know what it can do. And then subsequently, I think now when you look at those lenses and again change the attitude of innovation rather than expense, and then partner up with companies that can do it because you know it's going to be efficient and it's going to cost you less in the long run. It's just your willingness to explore this, even though you might not know about it.
Yes, I agree with you. So thank you, Nestor, for sharing your view on that. Where can our listeners connect with you or learn more about your work?
Yeah, so you can directly to me, our website, carbonworldhealth.com. Or you can follow me, Dr. Nestor Rodriguez at LinkedIn. Reach out to me. For me, I love talking, speaking, teaching. So any which way, whether I help people in their health journey or help people in kind of any issues they might have with their company, or they just want me to come speak on different topics to them, I do them all. And so they can reach out any of those ways, mention the podcast, and it brings you up to the list.
Thank you, Nestor, for sharing your expertise and practical insights. And to our listeners, if you are exploring ways to bring more efficiency, automation, or patient centric innovation into your practice, you can learn more at aisnpartners.com. This has been the Ascend podcast. Until next time, keep innovating, keep ascending.